Hi guys, so this is Oski with Ori. As I said, we are going to do pass or insert on a nasogastric tube. So here I am today with my beautiful self. Alright, so I'm going to start the procedure, okay? So let's assume all checks have been done. So I press amount of ample of hand gel into my palm. So palm to palm over dorsum, fingers interlaced, fingers interlocked, fingers interlocked, time rotating, fingertip rotating, fingertip. I did it for 30 seconds, allow you to drive for 10 seconds, and I assume my 30 seconds has passed, and I'm happy to approach my patient. So my patient is here, that's my patient. So, hello, I'm Abena, one of the nurses taking care of you today. How do you want me to call you? Frankie. Okay, Frankie, I'm here to pass a nasogastric tube from your nose to your nasopharynx, then to your esophagus to your stomach, as directed by doctor today at 10:00. So this is to help with your feeding and also administration of medication and also intermittent flashes. Are you happy for me to do this, please? Okay. All right. So thank you very much. Before I go and prepare my medication, I'd like to give you some few instructions before I leave. Okay. Is that okay with you? Okay, so the first thing is that when I'm passing the NG tube and you feel so uncomfortable and in so much pain, you want me to stop, can you do so by raising your hand? The second thing is that if I encounter any obstruction, I'll try again a slightly different option or use the other nostril. The third thing is that if there's any distress such as uncontrolled coughing, okay, or breathlessness, I'll remove the tube immediately. So these are the few instructions. I also want you to sit in a upright, semi-upright position and also support your head with pillows so your head does not tilt forward and backward. Is that okay with you? Okay, so I'm going to prepare the equipment in case you need me. Candy, use the call bell. Okay, I'm just nearby. I perform hand hygiene according to WHO standard. Okay, so as long as I can confirm my tray and trolley is clean and ready to be used, can you confirm whether it's been cleaned for the past 24 hours? It says. So I have my apron and my gloves here, which is clean. So I have my apron and my gloves, which is clean. I have my system measuring here, which is clean and inside. So can you confirm whether it's in date? I have my pH virgin strip here. It is stored in an airtight container, not exposed to air. Expiry date is 7 months 2026. I have my bowl of water here, which is clean and inside. So can you confirm whether it's clean? I have my adhesive tape here, which is clean and intact. Can you confirm whether it's in date? Then I have my NG tube here, which is intact and clean. Can you confirm whether it's in date? Then I have my gauze, clean and intact. Expiry date is 10 March 2026. Then I think that is all that I need. Yeah. I can confirm everything is intact, so I'm happy to approach my patients. I perform hand hygiene according to the WHO standard. Then go to my patient. So, Frankie, are you happy for me to start the procedure? So I've already performed hand hygiene. I'm happy to approach my patient. So, Frankie, I'm about to start the procedure. As I said, you're already in a semi-upright position with your head supported, the back of your head supported with pillow to prevent your head from tilting forwards and backwards. Okay, I would like to check the patency of your nostril. Is that alright? So can you block one part of your nose and sniff through the other one? Can you block the other part and sniff through the other one as well? So as long as I can confirm my patient's nostril is patent and I'm happy to use it. Okay, good. So now I'm going to don my PPs, perform hand hygiene, and don my. Always perform hand hygiene before donning your PPs. Don my. Okay, so I'm going to measure the NG tube from the patient bridge of the nose to the earlobe, then to the xiphostenum. Okay. So this is my NG tube. I'm going to measure the patient from the patient nose, okay, to the earlobe, then to the xiphostenum. Okay, so from the nose to the earlobe, then to the xiphostenum. So I had a figure of 60, so I'm going to add about 5 to 10 centimeters. So I'm going to use 5 centimeters. So I'll mark it at what? 65. So if you have a marker, you mark it at what? 65 centimeters. Good. Alright, so my patient is already in a comfortable position and all that. So I'm going to lubricate the tip. Okay, about 15 to 20 centimeters of the tip using what? Water. So I have warm water here. I'll lubricate the tip about 15 to 20 centimeters. Okay. I'm going to insert the NG tube from the floor of the nose, the nasopharynx, then to the esophagus to the stomach. So I'm going to ask you to swallow as I slide it inwards and backwards. Okay, so I'm going to slide it inwards and backwards. Now I already have a Hillary, and I have a working receiver here in case you want to vomit. Can you let me know? Examiner, I also have a working oxygen and suction machine here in case there's any distress or there's no more secretions. I'll use that. I'm going to slide it inwards and backwards. So as I ask you to what? Swallow. Okay. So you slide it inwards and backwards, inwards and backwards. Swallow. Keep swallowing. Swallow till it gets to what? To the mark I'm supposed to get. That's like 65. Okay, good. So you've got your 65. I'm not going to use the adhesive. You tie around the patient's nostrils. Okay, so you're going to tie this at the patient nose. So make sure you divide it this way. Okay, then you put it on the patient's nostrils and tie it against the